Good afternoon. My name is Faith Freeman, and I will be presenting my research proposal, which focuses on comparing two advanced microbiology analyzers, the Matrix Assistant Laser Desorption Ionization Time of Flight, MALDI-TOF, and VITEC-2. These systems are essential in identifying bacteria and fungi and antibiotic susceptibility patterns, vital in managing critical care patients in the ICU. In this presentation, I will outline and explain how these technologies differ and are similar in terms of accuracy, efficiency, and areas of applicability, as well as why this comparison is essential for future clinical diagnostics. MALDI-TOF and VITEC-2 are the most advanced technologies currently used in clinical microbiology laboratories. MALDI-TOF is a fast and accurate method of identification of microorganisms based on the analysis of their protein profile by mass spectrometry. On the other hand, VITEC-2 is a fully automated system that identifies bacteria and fungi through biochemical tests and performs ASTs simultaneously. The goal of this presentation is to assess their performance in accuracy, efficiency, and especially their applicability in clinical settings, particularly in the ICU, where time is of the essence in the diagnosis of disease as outlined by Franco Durante et al. 2020 and Saptawati et al. 2020. The use of rapid diagnostics is essential in critical care, especially when dealing with life-threatening infections such as sepsis. This is because the timing of treatment decisions is crucial as it determines the outcome of the patients. According to Kim et al. 2023, clinicians are therefore able to identify the pathogen causing the infection and thus avoid the use of broad-spectrum antibiotics, a factor that goes a long way in preventing the development of antimicrobial resistance. The study aims to establish the accuracy, speed, and appropriateness of MALDI-TOF and VITEC-2 in identifying bacteria and fungi, including their antibiotic susceptibilities. The performance investigated, in particular, will focus on both MALDI-TOF and VITEC-2 in the setting of an ICU, where speed and reliability of diagnosis are absolutely crucial. In reference to Tai et al. 2021, the study will determine whether rapid pathogen identification will be able to guide appropriate antibiotic therapies, reducing the time to effective treatment. In turn, this would provide an understanding of their capabilities and shortcomings, thus enabling better diagnostic workflows with improved patient outcomes in critical care. MALDI-TOF identifies microorganisms based on the analysis of their protein composition. The system generates results within a span of a few minutes. According to Kim et al. 2023, MALDI-TOF is one of the leading technologies in the laboratory. For such technology, therefore, in active clinical settings, MALDI-TOF's capability to handle a large number of samples at the same time is of paramount importance. In critical care medicine, every minute counts, and MALDI-TOF thus provides the clinician with an early clue to the infecting organism. VITEC-2 is an automated system that identifies pathogens and studies their antibiotic susceptibility. However, VITEC-2 is not as speedy in giving results as compared to MALDI-TOF in identification, yet it yields more information on the sample, including AST. As established by Hussein et al. 2020, this makes VITEC-2 quite helpful in clinical practice in that it helps as far as decision making is concerned regarding treatment strategies, particularly with MDR organisms. It is therefore suitable for performing high throughput analysis since it could test up to 60 cards at a time. The study will be a prospective clinical trial that aims to investigate the efficiency of MALDI-TOF and VITEC-2 by samples derived from patients in the ICU. The study will be conducted to establish with certainty whether the two systems are effective when compared with the traditional ones like gram staining and biochemical tests. As such, with regard to Tai et al. 2021, an attempt should be made to determine its precision, the time taken for determination, and also how it agrees with other standard methods like 16S rRNA gene sequencing for identification and microdilution for the determination of antibiotic resistance. Turnaround time, identification accuracy, and diagnostic effectiveness are some of the performance indicators in a clinical setting to which the study will refer with special reference to critical care. MALDI-TOF-based identification of microorganisms has indeed been exact, according to Kim et al. 2023, since studies proved its efficacy and had a success rate of more than 95% for most of the bacterial and fungal species identified in clinical practice. This system is particularly useful in the in the differentiation of closely related species because it considers protein variations on a molecular basis. Thus, MALDI-TOF has become an asset in clinical microbiology, where the identification of a pathogen is promptly done with high accuracy. According to Saptawati et al. 2020, VITEC2 has accuracies ranging from 85 to 99%. Hence, it is a sound system for the identification of bacteria. However, it has been noted that some of the factors depend on the performance in VITEC2, including the quality of the inoculum used, species under test, and the antimicrobial agents. Nevertheless, these limitations should not be used to disregard VITEC2 since it is a superior technique compared to the conventional methods in the identification of microorganisms in AST. Hussein et al. 2020 assert that due to the reduced human interfacing, the system is very reliable. Extensive use of the technique in the hospital microbiology is greatly needed, especially for cases that call for several tests. An identification by MALDI-TOF takes less than an hour. Tatse et al. 2021 report that the system is able to process up to 96 samples at once, ideal for any busy laboratory. Moreover, speediness supplemented by automated data analysis helps reduce the labor involved in getting the results and helps increase productivity in the laboratory. This is of much importance in critical settings such as the ICU, whereby early identification may result in earlier application of therapies and prevention of adverse outcomes. Although a bit slower in comparison with the MALDI-TOF in pathogen identification, one of the major strengths of the VITEC2 system is its simultaneously testing for antibiotic resistance. As Saptawati et al. 2020 suggests, VITEC2 can process up to 60 samples at once and will therefore deliver important information on the best antibiotics for the treatment of resistant infections. For routine clinical practices, MALDI-TOF works perfectly in the rapid identification of pathogens, while VITEC2 may be slower yet equally important for defining which antibiotics are effective, particularly in resistant cases. According to Torres-Santiago et al. 2021, both systems complement each other as MALDI-TOF gives a rapid identification and VITEC2 detailed information of antibiotic susceptibility to aid the doctor in choosing the best treatment. The expected outcome of this study is that MALDI-TOF produces results faster than VITEC2 in microbial identification, though the VITEC2 system will be more accurate in assessing antibiotic resistance. Saptawati et al. 2020 note that although VITEC2 is slower than the previous approach, it can help identify the appropriate antimicrobial therapy. Altogether, these systems can boost diagnostic accuracy and reduce the time to therapy, which of course is so critical in the case of infections, particularly in the ICU. Franco Durante et al. 2019 report that the utilization of MALDI-TOF and VITEC2 in clinical procedures has significant advantages in the healthcare industry. This is because diagnosis will be faster with higher accuracy, hence reducing the time it takes to intervene, avoiding complications, and improving the quality of care given to patients. Nevertheless, MALDI-TOF and VITEC2 have some disadvantages. While MALDI-TOF offers fast and accurate microbial identification, Franco Durante et al. 2020 explained that it cannot do AST on its own and requires additional methods. On the other hand, while identification and AST are provided by VITEC2, more time is required to obtain test results. Saptawati et al. 2020 have also described certain limitations of MALDI-TOF that include high costs of running equipment and VITEC2, which occupies a large area in the laboratory. In microbial diagnosis, MALDI-TOF and VITEC2 are of great influence. MALDI-TOF is suitable for direct characterization of pathogens. VITEC2, however, gives a full range of AST for the determination of correct therapy. However, more studies need to be done to decide how these systems can be interfaced to give a far more effective diagnostic outcome. These technologies are said to improve the accuracy of the diagnosis while at the same time cutting down the time to obtain results. Therefore, these systems are beneficial to patients, especially those in the ICU. Thank you for your time and attention.